This is Midday Mobile with Sean Sullivan on FM Talk 106.5.
All right, welcome back to Midday Mobile on FM Talk 106.5. It's also time for a checkup, and good to see back in studio Assistant Director of Substance Use Programs at AltaPointe Health, Misty Bowen. Thanks for coming back.
Thank you for having me.
Our conversations range through a lot of things that bring people through y'all's door. And I would say that sometimes we get typecast when you talk about an abuse disorder. You know, you think this abuse disorder is kind of a guy thing, or that's kind of a lady thing. But you're in today to talk about women's programs and substance abuse or substance use disorder affecting women differently than men. First of all, as a percentage, is it a 50-50 world? Is it heavier with one sex than the other?
It's really pretty much a 50-50 world.
Okay, it is. So we get this idea. We think about that's mostly guys, but some women, but that's not the case. It's
not the case. In fact, even though it's a 50-50 world with women, the progression is faster. So from first use to use becoming problematic tends to be faster in women.
You know, looking at this, I want to come back to that because you oversee that special women's program designed to address the unique challenges that women face when seeking treatment. Was the system built for the other 50% guys, and now you've got to do you have to like retool it for women, or what's the scenario? What were you faced with?
I would say historically that treatment certainly was back in the day for men, and mostly men were the ones who would seek treatment. Women were a little bit late to the game. Even
though we have this at that point, even they were getting treatment, they probably 50% of the people that needed it were women out there.
Absolutely, yes.
So first of all, you talk about so the progression from first use of a drug to being addicted to it faster in women. Yes. Is it a brain game or is it a chemical game? What have y'all figured out why?
Haven't really figured out why. I wouldn't be able to say why. You know, I can just say that when you're looking at women and, and doing this for a number of years, what you're seeing is a lot of different issues that they're facing than men typically tend to face, or at least typically tend to bring with them into a treatment setting. So you're looking at things like, women tend to have lower wages, and they tend to have more issues with childcare, and they tend to have a lot of trauma, and that can't be overlooked when it comes to addiction, because trauma can be a source of why we continue to use the drug. For example, 1 in 3 women have had some sort of intimate partner violence in their lifetime, and of the people who come in for substance use disorder treatment, you're looking at anywhere from 50 to 99% have had just some sort of trauma overall happen. So just different issues that they're bringing into treatment, and different ways that they want to or feel comfortable addressing those issues. And that's really the heart of our special women's program, is providing that safe, gender-specific, women-only environment so that they can talk about the things that have happened to them over the course of their life that may be different, that may have started them on their path to addiction, or may have happened to them during the course of their addiction that's making it harder for them to pull themselves out of that addiction and attain that short-term and long-term recovery. And on top of that, you have, let's say they have children at home. They have a 3-year-old, a 7-year-old, and a 14-year-old. And, those are also barriers that we're trying to address through, childcare and assisting them in different ways so that they can come into treatment and hopefully stay in treatment and attain that long-term recovery.
Well, and so holistic, you have to have that person there. And so you have to is it that y'all make suggestions to that person about childcare, or you have avenues that say, have you tried this, that, or the other? I mean, how do you navigate that?
We have some avenues for them for childcare, and we try to, whenever they come into our intensive outpatient program, and now this is assuming, of course, that they're in our program, we're trying to remove the barriers to treatment. So if a barrier is childcare, then we're working to remove that barrier so that they can stay in treatment with us. And part of that's through childcare, and part of that is offering different hours of the day that they can come in so that they can make different arrangements for themselves and for their families so they can, seek out and stay in the treatment setting.
I know you're dealing with a lot of women with issues with alcohol and opioids out there, probably biggest drivers. Y'all have some medications that, I don't know what they're called, that to treat addiction, right? It's not just talking through it. There's
Right. Yes, you have talk therapy, and so we offer talk therapy. We also have peer specialists who are people who have lived experience in recovery from all walks of life to help them. And then we also have, for certain types of issues like alcohol use disorder and opioid use disorder, we have medications that can help with the withdrawal and the cravings that they're going to face. So those medicines, we have Suboxone and we have Vivitrol and we have Sublocade. And in our Special Women's Program, all of those are free. And they're free in most of our programs for people who, meet the income requirements. So, and I can talk a little bit about those medications if you like me to.
Yeah, because you can talk specifically or in general. I'm going to ask this. I'm an outcomes-based person. Like, I'm sure there's been some blind placebo, whatever it's been done. You have two people that have this addiction. One person uses these medications, one person doesn't. Has there been comparison like that? In other words, do you have success with this?
We have success with this, and
you think better than not having it?
Yes.
Okay.
Yes. In combination with treatment, not just the medication, but also the clinical services that we offer as well. And some of the medications that we offer are a daily pill or a daily strip that you take every day, but we also have, and that's Suboxone. And
Suboxone deals with
opioid use disorder.
Okay.
So we have that, but we also now have an injection that you can take. It's a 28-day injection. So you can come in and you can take an injection. It's the same pretty much as the Suboxone.
You don't have to remember to take your medicine.
Don't have to remember to take it. It keeps like a steady rate of the medication in your system, and no one has to see you taking it. You don't have to worry about like your children getting into it.
Right.
So it has a lot of different safety features to it, and of course it's a 28-day commitment because once you take the injection, you're pretty much committing for 28 days that you're not going to just stop taking your medication.
No, that's good. I mean, it shows dedication. That they're not. So, and part of this is there's the medication, there's a talk therapy. This is all about, I think y'all was talking about right here, withdrawal management, right? With like managing that. So this is multi-steps.
Yes. So at AltaPointe in September of 2024, we actually opened a withdrawal management unit. So we have a special unit now for people who need help with the early stages of withdrawal, which can be very dangerous, and also, it can be overpowering to go out and use again. So the withdrawal management unit offers a safe space with physicians and nurses to help them in that early part of their journey. And then after the 1 to 7 days of the withdrawal management unit, they can have a warm handoff to us and to our outpatient programs or to a residential program, and we can continue them on those medications to address the withdrawal and the cravings. And again,
at that point, I mean, we'll probably run out of time, but after 7 days, is the addiction, if you had to say, is it 100% mental, 0% physical, 100% physical, 0% mental, 50, like where, like
after 7 days, you can say the person is stable and they're on their early path, but they're still at a stage where they need a lot of help and a lot of treatment in most cases. Okay. So, yeah, they really need that follow-up care to go to that next step. So,
there's still an addiction element after 7 days that could be a little bit physical, but then mental. And I can imagine that you started this conversation off that said a lot of these women that come to you this is part of trauma. So it seems like until you deal with that trauma too, you're just waiting.
Right. You have to deal with the whole person. If it's a person that has suffered some significant traumas, and, just giving you some examples, we've had clients who have witnessed a parent die in front of them when they were children from violence. We've had, multiple sexual assaults, molestation. These things, they're hard. You don't get over those overnight.
You don't get over them at all. You don't get over them in 7 days.
You don't get over them at all. You learn to live with them, and you learn to cope with them, and you learn to move on with your life. And that's what's so great about the Special Women's Program is it's just so beautiful to watch that journey of someone who comes in and they just feel like everything is going wrong in their life. Maybe child welfare, they have a safety plan, their children are having to stay with someone else. They come into the program and they become these strong women again who are able to like raise their children and just be the parents that they either used to be or that they've always seen themselves wanting to be. And it's just, it's beautiful to watch.
I'd love to see your smile when you talk about them. So women listening to us today, they're struggling with that. What step do they need to take? What do they need to do to get to more information or come into the program?
So it's really simple. All you need to do is call 251-450-2211 and let the person on the other end of the line know that you're struggling with substance use. And again, there are no financial barriers. All you need to do is make a commitment to come in and get the help.
All right. Assistant Director of Substance Use Programs at AltaPointe, Misty Bowen, thanks. Thanks for coming back in.
Thank you.